Hello, everyone, and welcome to the My Food Project's 11th webinar on migration and food insecurity in Quito during the COVID-19 pandemic. My name is Alison Pedrocielo. I'm a PhD candidate here at the Balsillie School of International Affairs and contract faculty in political science at Wilfrid Laurier University. I'm also a gender and migration researcher affiliated with the International Migration Research Center, the IMRC, and the Migration, Mobilities, and Social Politics Research Cluster. So today, I would like to begin by acknowledging the land from which we are convening virtually today. So Wilfrid Laurier University and its campuses are located on the shared traditional territory of the neutral Anishinaabe and Haudenosaunee peoples. And this land is part of the Dish with One Spoon Treaty, and that was signed between the Haudenosaunee and Anishinaabe peoples and symbolizes the agreement to share, protect our resources, and not to engage in conflict. So from the Haldeman Proclamation of October 24th, 1784, this territory is described as, quote, 6 miles deep from each side of the Grand River, beginning at Lake Erie and extending in the proportion to the head of said river, which them and their posterity are to enjoy forever, end quote. So the proclamation was signed by the British with their allies, the Six Nations, after the American Revolution. And despite being the largest reserve demographically in Canada, those nations now reside on less than 5% of this original territory. So the Balsillie School, which is located on this land, is home to the My Food Project. So let's talk a little bit about that project. It's My Food stands for the Migration and Food Security Project. And this project aims to design and implement a new and innovative, high-impact global research and knowledge mobilization agenda, which is focused on the neglected interactions between migration and food security in the Global South. So the project is funded by SSHRC, or the Social Sciences and Humanities Council of Canada. It's being implemented by the Hungry Cities Partnership, which is a research collaboration between over 90 researchers and partner organizations in 13 countries. So we invite you to check out our website, hungrycities.net, to learn more about the My Food Project and various other research projects that we are working on in relation to food security and migration. So without further ado, I'd like to introduce today's speakers. We have Cheryl Martins, if you wanted to advance the slide. Yeah, there we go. Cheryl Martins is a research professor in sociology, and she's the director of the Institute for Advanced Studies on Inequalities. She's also the social sciences coordinator in the College of Social Sciences and the Humanities, and she's based in Ecuador at the Universidad San Francisco de Quito, or San Francisco University in Quito. So she's led several research projects there on migration, health, and food security, including most recently an IOM MSP study on access to sexual and reproductive health and protection services with a focus on migrant women and teens. Another study on human mobility and shelters in Ecuador with CARE International, and a study on the vaccination process for migrants in Ecuador with the University of Geneva. So she's currently a co-PI on the SSHRC My Food Project in Quito. And she is joined by Mercedes Eguiguren, who's currently a postdoc researcher at the same institute at the Universidad San Francisco de Quito, and a visiting researcher here at the Balsillie School of International Affairs, also working on the My Food Project. And so Dr. Eguiguren's research interests focus on the relationships between mobility, sociospatial inequalities, and the subjective experience of migration. And she has researched and published on the links between international and internal migration, on aspirations and social imaginaries as drivers of migration, also on the migration development nexus, the contemporary history of Ecuadorian migration, as well as migration policy and political narratives. She also serves as the co-chair of the Latin American Studies Association's Ecuadorian Studies section. So our speakers will be presenting for about 25 minutes today, and afterward we'll have about 20 minutes for Q&A. And you are welcome to submit your questions preferably using the Q&A function although the chat will also be open if you'd like to communicate with others in this call. So with no further ado, I will hand it over to our speakers, Cheryl and Mercedes.
Yes, good afternoon. Wonderful to be here. Thank you. Maddie Mercedes is going to share a presentation right now. And in terms of what we've been able to look at from Quito, we're part of the My Food project, and I'm the country lead for Quito, together with Miriam Paredes. And what we've been doing is looking specifically at migration policy to begin with. And so our focus for now has been on migration policy in especially, what we're going to be speaking about today is the COVID-19 pandemic. Because I think what's important to note is that COVID-19 pandemic within the literature, it's frequently found to have a disproportionate impact on migrants in the global south. However, there's been a lot less attention to more integrated approaches that also consider how the pandemic has affected job and food security. And so our research is based on an SSHRC and CIHR multi-country research project on migration and food security in the global south in the context of COVID-19. And we'll be speaking about the case of Ecuador and also focusing on how the state and other institutions, specifically international organizations in Ecuador, have been responding to the pandemic and the impact on migrants. The migrants we'll be speaking about are generally Venezuelan migrants that make up about 95% of the migrant and refugee population in Ecuador. And we'll be drawing on policy research, including publications by the Ecuadorian government and international organizations. And our main argument is that the Ecuadorian state responses to the social and economic effects of the pandemic excluded migrants who were often forced to seek emergency aid from international organizations. And we'll speak as well to how international organizations are starting to play an increased role in Ecuador and in defining policy as well.
So, hello everyone. It's wonderful to be here presenting our work today. I'll be giving some important features of the context in the region, starting with some important changes in migration patterns in South America in the last 20 years. So one of these patterns is that there has been an increase in immigration in almost every country in the region. And the majority of this migration is coming from other Latin American and Caribbean countries, which signals a turn towards South-South migration in a region which was previously characterized by immigration to global North destinations. Other important feature is that in the region, immigration processes are embedded in multi-dimensional crises that take place. Therefore, recent migration in South America has been labeled as migration in contexts of crisis, which means that the precarious living conditions of migrants constitute a trend that marks our contemporary migration context, while at the same time it complicates the understanding of migration dynamics. And another very important thing to have in mind is that currently the Venezuelan migration is the largest exodus in the recent history of the region. Venezuelan migration, which has been studied as forced migration, and likely the first mass migration in the region triggered by food insecurity as one of its main causes. In Ecuador, in the last 20 years, there have also been some important trends that evidence the increase in general mobility patterns in the population. First of all, it's important to know that Ecuador has been historically a country of migration, which in the last of emigration, outmigration from Ecuadorians to other parts abroad. We experienced as a country a mass exodus at the turn of the 21st century, which has turned into a sustained immigration flow, and in the last 2 years has been peaking again. At the same time, we have important immigration patterns. Since the early 2000s, Colombian population displaced by the internal conflict has sought refuge in Ecuador. And since approximately 2015, the country hosts the third largest Venezuelan immigrant population in the region. Ecuador is also an important node of transit migration from South America and from extracontinental origins. In Quito, specifically in the city of Quito, the capital of Ecuador, located in the northern highlands of the country, a majority of migrants comes from Venezuela, and the second largest immigrant population is of Colombians. The literature shows that Venezuelan migrant is best described as forced migration, and that means that migration that occurs because of multiple push factors that threaten living conditions, which are, however, not recognized by states and international law as sufficient for granting asylum. In this sense, the recent Venezuelan migration that we've been experiencing, receiving in the country, is different from previous migration flows, such as those of Colombians, which have been partially granted asylum and are more traditionally, one could say, more traditionally characterized as asylum seekers. Venezuelan migration in Quito and in Ecuador in general is made up of an economically active young population. Their migration movements have been really recent. They have patterns of high mobility, of transit migration. They don't tend to establish, at least at first, in one city or one destination. They sometimes continue their journeys into other countries of the region. And the majority of these migrants make a living in the informal sector. During the pandemic, we see through the literature that there have been severe impacts of the pandemic and of the mitigation policy put in place by the state in the face of the pandemic, which have caused impacts such as job loss, reduced income, evictions, general barriers for healthcare and services, and food insecurity. Immigrants were already facing precarious living conditions in this context prior to the pandemic, because of their irregularized migration status and because of their insertion in the informal sector. But with the arrival of the pandemic, the conditions have worsened, and as well, the economic conditions and the living conditions have been deteriorating for the general population, as the statistics show. We also think it's important to take a look at recent shifts in migration policy in the country to understand how the state and other institutions, international actors mainly, have responded to migration in the context of the pandemic. So between 2008 and 2010, migration policy in Ecuador went through several reforms, where it sought to prioritize the rights of the migrant population. And this resulted in the constitutional recognition of the right to non-discrimination based on migratory status and the introduction of the notion of universal citizenship, among other important protections granted. But since 2010, we see a shift where, despite constitutional guarantees and the political discourse that emphasize the rights of the migrant population, Ecuadorian migration policy showed the recurrent application of migration control measures, including detention, expulsion, deportation, and increasing administrative costs for procedures, in addition to the stagnation of the asylum and refugee system. And this is very relevant to our findings. Since 2018, we identify other important changes, such as, on the one hand, the state increased the barriers for access to migratory documentation, which particularly affected the Venezuelan population. In this sense, Herrera and Cabezas identify a process of transformation of state policy towards deterrence measures, particularly for the Venezuelan immigration. And at the same time, there has been a growing influence of international organizations and international organizations platforms, such as the R4V, the Interagency Coordination Platform for Refugees and Migrants for Venezuela, which is led by the IOM and the UNHCR. And there has been the rise of humanitarian discourse to understand and to act upon migration, which has, which, as we will see, will have certain effects in how migration is addressed in the country. For example, one important issue for our topic is that with establishing of R4V, which is the working group for migrants and refugees in Ecuador, the GTRM, certain areas of intervention began to be established, such as assistance for food security. We draw, for our work, we draw on critical migration governance studies, which is a line of research that analyzes the shift towards migration governance, which has been in place since the 1990s, and in which the regulation of migration goes beyond national states and involves other kind of actors, such as international organizations and NGOs, as well as networks of actors, and where border control is combined with a model of migration management. Migration management, in its turn, has been analyzed by the literature for its links to a wider neoliberal project for the regulation of migration, in which migration control is implemented through, we could say, softer, indirect means, and it involves the principle of steering migration to make it functional to economic dynamics and goals, mainly those of the destination countries in the global north. Migration management is frequently presented as technical and neutral, although it is connected to specific interests of governments, and it implies the depoliticization of migration and also the naturalization of politically produced conditions of living and of migrating, such as vulnerability, risk of journeys and routes, and needs of migrants. Recently, the literature has analyzed a turn towards the humanitarian governance of migration or humanitarian migration management, which implies, among other things, a moral government of the population, meaning that the intervention is presented as addressed toward ends that cannot be easily questioned, such as the protection of vulnerable migrants and assistance in case of crisis or emergency. Also, the literature shows how migration is constructed as an issue in need of humanitarian responses, and the role that the processes of datafication of migration and data extraction are used as migration control tools, which are rendered possible by humanitarian assistance, as by the work of Martina Tazzioli, for example. Here, the assistance for food security is a key humanitarian issue. So we're aiming for this literature to help us interpret how are different political actors addressing current migration issues in the country and more broadly in South America. I'll then hand it over to Cheryl, who will explain the methodology of our work.
Yeah, thanks very much, Mayor. Yeah, in terms of our methodology, it's important to note that what we looked at within our study, and as this work is part of our broader study, today we're just able to really get into details pertaining to our systematic review of governmental and organizational documentation between 20 and 23. We will touch on, however, the household food security survey, as well as some of the work we've done with the stakeholders. So right now I'd like to present the findings and focusing especially on the impacts of state actions and international organizations, the vaccination campaigns in particular, as well as considering food security assistance during the COVID-19 pandemic. Okay, I'd also like to speak to you about the state's measures of the pandemic mitigation and actions in particular. So it's important to note that from the outset of the pandemic in Ecuador, the government was especially focused on law enforcement. Okay, and because they were so concerned about the movement of the population and controlling the movement of the population, that other social policy measures were largely ignored. So this include public health policy, campaigns to inform the general population and migrants about COVID-19 transmission, food security measures. When they did start to come into place, they were focused on especially the general population. And it's important to note, though, in Ecuador, that food security is a major issue because 70% of Ecuador's population works in the informal economy. And with the lockdown measures, it was impossible to go out. And then, of course, there was a real focus on controlling the population and making sure people could not go out. And so this had a huge impact, and even more so for migrants. And the partial suspension as well of migration document processing, together with the shift to virtual public services during the pandemic, reduced the access to legal documentation for migrants. And at the same time, there were austerity measures that created a scenario of increased risk and abuse, as well as exploitation of workers. And migrants were excluded from social protection measures, such as cash transfers and the distribution of food rations. They were, however, included in the COVID-19 vaccination program. And so for that reason, I also want to discuss the timeline of Ecuador's vaccination program. It's important to note here that there were phases that, at the beginning of the pandemic, where we had one government. This is Lenin Moreno's government, and that government was in power until May 2021. So in this first phase, migrants were completely excluded. In order to be able to access the system, it was important to use your voter registration and your ID number. And so migrants were generally not on the voter registration list, and which was used by the Ministry of Health. Okay, so this was in like the phase 0, phase 1. And so it was definitely very clear that nationals were the main people who were going to have access. And as a result, a lot of migrants died in this period of the vaccination process. And there was a lot of frustration, and then there is increased need on the part of local organizations, and also they work together, especially with the international organizations, to pressure the government in order to see a vaccination program that would include migrants. But I think it's important to note that even when we have the transition from the Lenin Moreno government to the Guillermo Lasso government in May 2021, it still took some time and a lot of pressure from different organizations for the process to incorporate migrants, because things like having an ID card or not were often used by gatekeepers at the vaccination facilities to stop people from accessing the programs. Okay, so the important thing here too is to understand how also these gatekeepers were playing a very important role in making it possible for migrants to access services or not. And I think we see this in other realms as well, not just the vaccination program. Okay, so go to the next slide. As a result of the campaigns led by humanitarian organizations, which happened within the Guillermo Lasso administration, kind of from, I'd say, from June, and especially in July, these campaigns were being organized. Now, it's important here, you can see on this slide that the Ecuadorian government is mentioned as one of the sponsors of this campaign. However, it was a campaign that was organized and orchestrated by GTRM, which is the group, the working group for migrants and refugees that is led by organizations such as the IOM. And so here we can see in this campaign, the slide about this campaign, where they're trying to say that everyone can get COVID-19. So this is to educate people about COVID. And so the idea that the humanitarian organizations had is that they wanted to make sure that everyone understood that it was their right to have access to the vaccinations, and so this is something that even though the Ecuadorian government was, formally part of it, it was completely led by humanitarian organizations. And I think it's important to look at the food security demands and organizational responses as well. On the one hand, what we have is the food security assistance demands, okay, which we can see grew from 462,000 requests in 2020 all the way to 628 in 2022. However, if we see the target groups refer to the services that were budgeted for by the actors within the GTRM groups. These really amounted to around half of the actual demands that migrants had. And then when we look at what actually was allotted in terms of funding, we see that number again goes down to close to half. Okay, so at the end of the day, there's a lot of lip service. There's a lot of talk about what needs to be done and so on, but we actually don't see enough action. Okay, in terms of what we've been able to find with regard to our household, general household survey, within this survey, we had a sample of over 1,000, and within that, the percentage of migrants was 4.25%, which matches the general population and migrant population within Quito. And our initial findings are that the income of migrants was impacted more than for the general population. So 63% of migrants mentioned that their income was impacted, as well as the way in which migrants had to respond because of this, the real severe impact to income. There is a need to be proactive with regard to changing the situation and improving their situation. So 63% reported that yes, that they had taken specific measures in order to mitigate the loss of income, whereas only 44% of the general population mentioned that. And migrants also experienced a greater sense of threat to their food security. So one of the questions we had on the survey is, during the pandemic, did you feel threatened by lack of food? And so more than half of the foreign nationals said that they did, whereas only 33% of nationals actually said that they'd felt that their food security was threatened. Okay, now it's important to note that these are findings that with regard to the migrant population need to be looked at in greater depth. And for that reason, we have a second survey that we're going to be doing, where we're going to be looking specifically at these kinds of questions to be able to ascertain with a much larger sample that the pandemic had this kind of impact, and we also are very interested in looking at the agency of migrants and what they did in order to mitigate the impact of loss of income. Okay, so with regards to the conclusions, one of the main things I think that we're seeing across the MyFood network is that food security is a factor that is intimately related to social precarity in the global south, and the effects of the pandemic with regard to migrants, living conditions, and policy responses are connected to policy models that have been in place. In the case of Ecuador, we're looking at austerity measures, and then we have the growing role of humanitarian migration management, right? And so instead of the state leading, or the state saying, hey, well, okay, we'll do this campaign together with you, but we want it to work like this. We want to, have certain criteria that are part of it. The government has basically washed its hands of any responsibility with regard to these types of campaigns, and even to do with health services in general, we're seeing this. And so this means that we've got an increased role overall for humanitarian organizations. And this has been very much related to the fiscal austerity measures in Ecuador and the reduced social spending. And with regard to humanitarian migration management, there has been as well a relegation of migrants to being, those who receive assistance, subjects of assistance. International organization and humanitarian intervention has also it's overall what we can see is a strengthening of the broader scheme of migration management. Okay, within the model of neoliberal governance. And this hinders possibilities for long-term integration, as opposed to making it possible to really see models come into play that are focused on integration, that work on addressing xenophobia, for example. Maria Mercedes, I'll pass it to you to add your final comments so that we can then take questions.
Yeah, Cheryl, thank you very much. I would only like to add that this is happening in a context, in a country in which there is still a legal framework that focuses on migrants' rights, that see migrants as citizens and participants of the national community. So what we're seeing is that addressing food security needs to take into account the general living conditions of the population and how they have been affected, and how there's been an undermining in general for migrants and for the Ecuadorian population of their possibilities, let's say, of social integration and citizenship. With that, I would really like to hear the comments, questions, and to engage in a dialogue with you. Thank you very much.
Thank you so much to Cheryl and Mercedes. So we are now going to have about 20 minutes for Q&A. And so you are welcome to pop your questions into, well, preferably using the Q&A function at the bottom of your screen. And I will take those and pose them to the panelists. So while you're thinking of your burning questions, I know I have a few thoughts that come to mind, having worked on migration governance in Latin America during the pandemic. And the first is about how states seem to be learning from one another as to how to, the download of these policy ideas regarding the humanitarian governance of migration. And I saw that in your working paper, you cited Luisa Celina Freire's work. And I wanted to bring to your attention a paper that she's put out with Nick Mizinski and Surapas, in case you're not aware of it, on refugee commodification and the diffusion of refugee rent seeking in the global South. And I wondered if you're familiar with this work, and if you find that useful to think about kind of the ways in which different states are learning from one another as to how to leverage the language of crisis, so the crisis framing, in order to essentially generate revenues, which may be managed by international organizations, but often channeled through state mechanisms. So I wondered if that framing is something that you're using to think about this.
Mm-hmm.
Definitely. I think it's very, very useful. Thank you, Alison, and I'll let Mary respond to this as well. I think that the leveraging of crises is a really good point, and actually it's something that I think is important to note with regard to the vaccination process for Ecuador as well, because they were able to leverage the crisis to really increase donor support in lots of areas, not just in terms of like the actual vaccines, which were mainly purchased by and donated by governments outside of Ecuador, but for other types of programs as well. And so I think that's a really important point.
Mm-hmm. Yeah, regarding to your question, Alison, thank you very much. I haven't read that paper from that you were citing, but I think this idea of refugee commodification sounds really promising, because I think it's important to look at the ways in which humanitarian assistance fits into this bigger picture, and there are geopolitical aspects of it, and also political economy aspects of it, in which the Venezuelan exodus and the Venezuelan crisis has really fit into a larger geopolitical purposes. In that sense, the cooperation or dialogues between states in the region also has to do with a certain geopolitical position towards the Venezuelan regime, and that is why I think that Venezuelan migration has been the greatest focus of these countries, and not only because of its magnitude and dimensions. That's one thought about your question. And the other thing is that this framing of humanitarian assistance definitely leads us to think of the ways in which there's a certain element of temporariness to the idea of humanitarian assistance and assistance in crisis that clashes with a more permanent conception of migration in society and of integration of migrants in society. So in that sense, humanitarian assistance also serves to the purpose of some states trying to not only to leverage the migration processes they are receiving for international funding purposes, but also that kind of, I think, frees governments from the bigger question of how to facilitate integration and how to facilitate processes of citizenship.
Thanks. Thank you for your response. We have a few more questions coming in. So one from Ryan Durante, who is a master's student here at the Balsillie School. Thanks you for your presentation, and has expressed his curiosity about the role of international organizations, and have they received pushback from the government? Has there been a crackdown of aid from these organizations, or are they simply left to fill the gaps with limited help?
They're definitely left to fill the gaps. They have received no pushback from what I can see from the government, except the pushback that could come on the grounds. There is always possibilities for resistance, right? So the pushback would come from workers within, for example, the Ministry of Health, who are just overloaded with other things that they're doing. And so instead of participating eagerly and being really cooperative, the pushback comes then in just not really engaging, and so see, overall, yeah, there's been a very heavy reliance and an increased reliance, and so I think that we're seeing, throughout the Lasso administration in particular, that has been the case. Mayor, would you like to add anything?
Yeah, I would like to add to that. Thank you, Ryan, for your question. These organizations not only have not received pushback, but I think they are the Lasso government, especially the government that is in office in Ecuador since 2021, has relied a lot on them, and well, also the previous government. And I think that the international organizations actually have been advancing a process of gaining legitimacy in society, one would say. Now they are really central actors, not only to creating migration policy and implementing migration policy, but also even in academia and in academic debates on migration. So they are seen as crucial actors, and not. I don't think there's much opposition actually to their work in the country.
So as a follow-on to that, we have a question about whether the speakers see any chances that in the future this humanitarian model of migrant governance might change, and under what circumstances. And I'll just add in another question while you're considering that one about the remittances. And there's been a considerable debate as to whether the pandemic has decreased or increased migrant remittances. Just wondering if you have any insights on the relationship in Ecuador with regard to Venezuelan migrants or Ecuadorians in other countries.
Okay, well, in the case of Ecuador, for those of you who have been following the international news, the government has just entered a completely new unknown phase. The government has dismantled the assembly, so the current president is defining all of his own policies, and that will be for the next 6 months approximately. It could go on to close to 8 months by the time we have a new government. So new elections are a part of our scenario in Ecuador right now. As a result, this humanitarian model is not going to be changing kind of in the near future. However, depending on the next government, there could be some changes and pushback, as we were just discussing, to the role of international players. I think that the government also has not had its own strategy really to be able to define where they want to go, and so as a result, it's been left to international actors to define the agenda. And I think that in itself, even if the government, for example, were to change and they didn't have that much more money to be putting into, some of the public services, that actually just by having a very clear strategy, that they could leverage the assistance they're receiving in a very different way. However, I also think that we need from academia to be really engaged in these discussions and to make sure that these discussions go beyond academia across the sectors. So from the work that some of us do with humanitarian organizations to the work that is also taking place with governments. So I think that all of that has to take place at different levels.
Did you have anything to add, Mayor, or should we go on to the next?
Well, yeah, just a couple of thoughts regarding to the question about the possibilities of change of this humanitarian model. I think that if anything in South America, where things are leading is to the profundization of this model. I think it's really important to look at how there has been, to a certain extent, a transnational, we could say diffusion of certain practices and schemes of migration management, and the humanitarian was first, I'd say, put in place in the case of Europe, of Southern Europe, and in the with a so-called crisis of migrants in the Mediterranean. So, for example, looking at what has been happening in Chile, I don't know if anyone is following what's happening there in the northern region of Chile, but there have been already some experiments of creation of camps, of refugee camps, which in Latin America, or at least in South America, has not been heard of until the present. So I think we may look at the expansion of this humanitarian model, and we should be really focusing on analyzing its implications. And about remittances, yes, there's a very heated debate to address Jonathan's question. In the case of Ecuador, what we know is that remittances coming from abroad, that is from Ecuadorians living abroad, have increased in the pandemic. In Ecuador, remittances from Ecuadorians have acted as a counter-cyclical economic factor in crisis, and it has shown in recent crises, the Great Recession, and now with the pandemic, remittances tend to always increase, even if that means, even if that happens with worsened living conditions for migrants abroad. I think there is not enough research on out remittances from Ecuador, mainly from the Venezuelan population, and that is one thing we will definitely be looking at in the continuation of our research.
Thank you. So now let's apply a gender lens to your work. I know that that's something that you do. So two questions. One from Zhenzhong. Could you please illustrate how women migrants and refugees may experience the whole migration and pandemic process differently from their male counterparts? And then I would add to that, I noticed in the paper that you presented or that you published in Land that there were some interesting focus group findings. Perhaps you'd like to share those with us about the differential impact of food insecurity on different family members, and because you're using maybe a migration lens, but then it seems like within migrant families maybe there are differential impacts. If you could share some of that with us, that would be great.
In terms of some of the differential impacts, I think that because of the important role that women migrants play with regard to food preparation and food provision, we could see, and in our focus group findings as well, demonstrated that that there was an exchange of food for services and so on within the context of the pandemic. That was pretty important, and I think that in terms of how women migrants have also been playing a really important role in mitigating the pandemic by coming up with creative ideas, creative solutions in order to respond to the pandemic. That has also been really important there. Mary, maybe you'd like to add a few more points.
Maybe it's also interesting to look at the relationships that have been developing between migrants and precisely institutional actors. Female migrants are generally usually privileged for assistance purposes. So that creates there's some recent research focusing on how that creates interesting dynamics within families and migrant communities, as for example, women going to ask for assistance for food rations, for example, and then sharing with their male partners who are not always eligible for assistance. So that's also some specific domain that I think we should look at a little more closely.
Yeah, I think the other thing too, I guess that is important to note with regard to gender and migration and food security is that often when it comes to ensuring the well-being of the family unit, that women are the ones who are most likely to give up their food rations, and then they're the ones to do without, and that came through in the work that we did, and that's what we want to look at more closely in our subsequent research as well.
I have one more question for you. It's my own question. So I know that during the COVID-19 lockdowns, it had a major impact on people working in the informal economy. And you mentioned that 70% of the population is in the informal economy in Ecuador, and that includes street vendors, right? Street food vendors, and that they were not allowed to continue working. And so I imagine that not only affected their own livelihood, but maybe also had an important impact in terms of the availability of affordable food options for, other migrants, but also for Ecuadorians, increasing their reliance on food aid, right? So I was just wondering if you could speak to that about not just their dependence on food aid, but also their role as providers of affordable food options and how that may have impacted food security for others living in Quito.
And that's a great question, and it was fundamental. The role of migrants during the pandemic in terms of being Uber drivers and transporting food, coming up with also some of their own business ideas. Because we didn't even have access to fruit and fruits and vegetables initially during the pandemic. And so new businesses developed, and these were often led by migrants. Because it was so important to be able to make ends meet, and for that reason, and also because they didn't have access to the state support initially, right? And so that's where we definitely could see a very strong role for migrants at the beginning of the pandemic in particular.
Mm-hmm. Yes, definitely.
Okay, there's one more that came in, a question about the impacts that COVID-19 had on migrant children and families from accessing food and needed services.
Mm-hmm.
And another one here, considering the double burden of malnutrition in Ecuador with high levels of chronic child malnutrition and adult obesity, coupled with increasing poverty rates, what multifaceted intervention strategies can be employed to address both undernutrition and overnutrition simultaneously, while also targeting income inequalities and improving food security in rural areas? So different parts to that question, but kind of coupling the malnutrition and the overnutrition and thinking about income inequalities and food security.
Mary, would you like to begin this time?
Well, yes, thank you for both questions. They raise very important points. I don't think we'll have the time, or our research in its current state can address those very specific issues. But what I'd like to say is that it's very important to understand that in Ecuador, these conditions were already underway before the pandemic. So there were already worsening living conditions, including food security, including malnutrition or the health-related issues. And that was affected even more than by the pandemic. So any measure, any intervention strategy has to look at the longer term, I would say, and not only take these situations as caused by the pandemic. That's very important, and to take into account both migrants and the general population at the same time, because those data points of malnutrition and obesity, for example, that one of our audience is citing, are available for the general population. So we don't know yet to what extent that they affect migrants. We suppose that to a larger extent, but I mean, people are facing these conditions of inequality within different communities, both within the Ecuadorian community and within migrants. So it's important to take both into account.
I think we're coming to the end of our time for today. So I'd like to invite everyone in thanking our speakers, Dr. Eguiguren and Dr. Martins, for sharing their important research on food security and migration in Quito as part of the My Food project. Thank you so much.
Thank you very much.
Thank you.